Hello everyone. Today we shall continue with the part 2 of our lecture on removable appliances. Now, learning outcomes for the lecture is to state the various components of removable appliances and its advantages and disadvantages. Describe the different types of active and retentive components of removable appliances and to discuss the clinical application of removable appliances for the treatment of different malocclusions. Okay, the removable appliances can be considered in three main components. Now, the first components are the retentive components, these which consist of various designs of glass. Now, the active components consist of bows, springs, and canine retractors. And the third component is the base plate, and this base plate can be modified to form either anterior or posterior biplanes. Let's have a look at the retentive component. Now, retentive components are very essential to ensure good retention of the appliances, and good retention is necessary for the success of treatment. And retention is achieved by the use of clasp, and clasps are basically wire work that engages undercuts on the tooth surface. Now, the most commonly used undercuts are the mesiodistal and buccolingual undercuts, and the designs varies according to the clinical needs. Let's have a look at Adams clasp. Now, this is one of the most widely used and versatile clasp. It was introduced by Phillips Adams and is also known as a universal or Liverpool clasp. Now, it engages the undercuts in the mesial and distal embrasure areas. It's usually for the Adams class on the first molars is fabricated from 0.7 millimeter hard stainless steel wire. Now, for all the other teeth, the Adams class is constructed from zero point 0.6 millimeter stainless steel wire. Now, the Adams class has a few parts to it. As you can see here, one is the bridge. There's two arrowheads. It's got two flyover arms, and there are two retention tags. Okay, some of the design features to take note of is uh, the length of the bridge should be approximately the distance between the mesial and buccal cusp. The arms of the flyover arms must be roughly parallel, and the bridge must be roughly parallel to the buccal surface of the tooth. The arrowhead should be inclined at an angle of about 45 degrees from the surface of the tooth. Now, it's very important that the flyover arm must be above the contact area of the tooth. Okay. Now, how is an Adams clasp adjusted? It can be adjusted at two positions. The first position is at the arrowhead, and the second position is at the flyover arm where it just emerges from the acrylic. Now, adjusting the arrowhead causes the arrowhead to move closer towards the surface of the tooth, whereas adjusting at the flyover arm uh, causes the clasp to move downwards. Now, the Adams class is a very versatile class and it can be modified in many ways to obtain retention in different situations. Now, we have a modification called the single arrowhead or half Adams, which can be used for partially erupted tooth. Then, to gain additional retention, we can even put an additional arrowhead on a adjacent tooth. or we can use put the bridge across two teeth in which it is known as a double Adams. Now, other modifications are we can put a helix on the bridge, or we can have a distal extension, or a J hook soldered to the bridge. Now, all these three are used for are made with the view of using for attachment of elastics. Now, a headgear tube can also be soldered to the bridge, and in which case it can be used to accommodate a headgear. Now, what are the advantages and disadvantages of Adams glass? Now, the advantage is it provides excellent retention. It can be used on deciduous or permanent teeth. It can be used on incisors, canines, premolars, and molars. It can be used on partially or fully erupted teeth with certain modifications, of course. All you need to fabricate an Adams glass is an Adams pliers, and it can be easily be repaired by soldering, and it can be modified. Okay, the disadvantage of an Adams glass is the wirework fabrication can be a bit difficult, and it is also because of the flyover arms, it is gives rise to greater occlusal interference. Now, the next class is known as the circumferential or C class, or a three-quarter class. Now, this utilizes the buccocervical undercut, and it extends circumferentially from one proximal undercut to the other proximal side. Now, there's a squash loop at the end of the C to prevent soft tissue trauma. And this glass is also made from a 0.7 millimeter hard stainless steel wire. What are the advantages and disadvantages of C class? Now, the advantage is the C class is very simple in design, which means it's easy to fabricate. It has less occlusal interference since it has only one flyover arm, and there is sufficient retention from the class, although not as much as an Adams. Now, the disadvantages is it only makes use of one undercut area, so therefore retention usually is not enough on by on its own. Okay, and thus it is used as a supporting class, meaning it can be used in appliance where they are also Adams class. It cannot be used on partially erupted tooth, and it can easily be distorted on insertion or removal of the appliance. Now, the Jackson class, also known as a full class, or it's known as also as a U class, also made from zero point 0.7 millimeter stainless steel wire, and is adapted along the buccal cervical margin, and it extends along the mesial and distal undercuts. Now, from the occlusal view, it appears like a U, and thus it's called known as a U class. Now, the next one is a triangular class. It's also made from zero point 0.7 millimeter hard stainless steel wire. It is used as an accessory class to provide additional retention. Now, the advantage of a triangular clasp is the small size clasp makes the appliance less bulky, and it's easy to fabricate. Now, the disadvantages is only a single clasp only uses one undercut area. Thus, again, retention is not sufficient on its own, and thus it's only used as a supporting clasp. Schwartz clasp. A Schwartz clasp is also known as an arrowhead clasp. There are multiple arrowheads which engage the interproximal undercuts. The advantage of a Schwartz class is gives better retention than a triangular class. This is because it usually have multiple arrowheads, meaning it can engage on more than one interproximal undercut areas. Now the disadvantage is the clasp is bulky, it occupies a large space in the buccal vestibule, and because it's bulky there is a possibility of soft tissue injury, and you need a special arrowhead forming pliers to fabricate this clasp, and the fabrication can be a time consuming exercise. The crozet clasp is similar to the Jackson clasp but with an additional piece of wire which is soldered to the main wire and is also made from 0.7 millimeter hard stainless steel wire. Now the advantage of a crozet clasp is easy to fabricate and the retention is better compared to a U clasp. But the disadvantage is you need a soldering machine to solder the additional wire. Now the southern class. Now the southern class is designed to utilize the undercut beneath the contact point between two incisors. Now obviously the clasp is not suitable to use if the incisors are very proclined. And this class again are made from 0.7 millimeter hard stainless steel wire. Now, the southern class is advantageous when used on incisors which are upright. The disadvantages is it can't be used on very proclined or retroclined incisors. Now ball-ended clasp. Now this is made from stainless steel wire which carries a knob or a ball-like structure at one end of the wire. The ball end engages a proximal undercut. Now again retention is minimal partly because only one proximal undercut is utilized and thus it's used as an accessory clasp. Okay, let's look at the next group of uh, uh, labial bow can also be useful for anterior retention, though it's commonly used more as an active component. It's also made from 0.7 millimeter stainless steel wire. Okay, now let's have a look at the next group of components, which is the active component. Now, active components are components which exert forces to bring about tooth movement. There are three main types of active components, which are the bows, springs, and screws, and a minor role for elastics in removable appliances. Now, labial bows. Now, labial bows are used for retraction of anterior teeth. In other words, a reduction of overjet, closure of space distal to canines, example, extraction spaces of first premolars, and also used for anterior retention of the removable appliance. They are made from 0.7 millimeter hard stainless steel wires and the bow is activated by squeezing the loops. Now, the labial bow consists of a bow obviously, and it has got two loops and it has got two retentive arms. Now, there are few various types of labial bows which are used in different clinical situations. Now, you can have the short labial bow, long labial bow, split labial bow, modified split labial bow, reverse labial bow, a Roberts retractor, Mills retractor, fitted labial bow, and a high labial bow with apron spring. Let's have a brief look at these different types of labial. Okay, first the short labial bow. Now this labial bow extends from canine to canine. The bow is parallel to the occlusal plane. It can be used for minor overjet reduction. The range of action of this short labial bow is limited due to the stiffness of the wire, and thus it is more suitable for retention than for major tooth movement. Now, please take note that the labial bow should be at the center of the teeth. Now, the size and position of the loop should be eh, the width of the loop should be similar to the distal two-thirds of the canine, and the length of the loop should be the same as the length of the clinical crown of the canine. Now the bow should be a smooth curve touching as many teeth as possible. Now the long labial bow is similar to the short labial bow except that it extends on the first premolar to the first premolar on the other side. Now, because of the longer wire, it is a little bit more flexible, and thus you can undertake overjet reduction up to 7 millimeters with the long labial bow, and it is activated by compressing the loops. Now, the split labial bow is a modified form of the short labial bow, whereas the bow is split or cut in the midline. Now, because although the bow is more flexible by cutting it on the midline, it is less stable and less rigid. And these split ends may cause soft tissue injury. Now the modified split label for in this modification, the free ends of the bow cross each other and they engage the distal surfaces of the opposite central incisors, and this bow is suitable for diastema closure. Now the reverse labial bow is activated by the opening of a U-loop. Now, the Roberts retractor has no U-loops but it has helices. It is made from 0.5 millimeter stainless steel wire. Now, this wire is very flexible. It is good for overjet reduction, but the distal part of the retractor needs to be supported on a stainless steel tubing. The Mills retractor is a complex design and it is extensive looping of the wire. Now, this looping of the wire increases the length of the wire, which makes the wire very flexible, but it is difficult to fabricate and there may be difficulty for the patient in inserting the appliance. Now, a fitted labial bow is a bow that is adapted closely to the labial surfaces of the anterior teeth. Is usually used for retention after completion of orthodontic treatment. Okay, the next category of active components are the spring. Now, let's have a briefly at the principles of a spring. Now, when a spring is deflected, it tries to regain its original shape. Now, teeth is moved when the spring returns to its original or passive state. There is a force relationship with the length and diameter of the spring. Now, the force generated is directly proportional to the modulus of elasticity and to the fourth power of the radius, and is inversely proportionate to the length of the wire. This means that when we double the diameter of the wire, the force of stiffness increases by 16 times, since it's directly proportional to the third power of the radius. Now, doubling its length reduces the force by 8 times. Again, this is because the force is inversely proportional to the length of the wire. Now, how can we classify springs? Now, we can classify springs simply by whether there is a presence of a helix or loop. In a simple spring, there's no helix, no loops, whereas in a compound spring, there may be helix or loops incorporated in the spring. Now, we can classify according to the stability of the spring. We have two types. One is the self-supporting spring and the other is the supported or non-self-supporting spring. And you can also classify springs according to the point of attachment. Now, if the spring is attached at only one end, then it is works on the cantilever principle, and we have the examples are like a cantilever spring, finger spring, and a canine retractor. Now, the springs may be attached at both ends. For example, as in a T spring, a labial bow, or a coffin spring. And the spring may be the third category, the spring may be just be an accessory spring. Example, as we saw, the apron spring. Now, what are the ideal properties of springs? Now, the ideal properties of springs are they should be simple to fabricate, easily adjustable, and easily seated in the correct position when the appliance is seated. It should be easily be kept clean by the patient. It should be robust and stable so that it doesn't distort easily. It should deliver gentle forces in the correct direction. It must not preferably produce unwanted forces, and there should be no irritation to the oral mucosa. Now, the spring has three parts. One is the active arm, number two is the coil or loop, and number three is the retention tag. Generally, all springs are variations of the cantilever spring. Now, this is a cantilever spring where the spring is the or wire is attached only at one end and the other end is free to move. Coil or helix. Now, the coil or helix should be of a minimum 2.5 millimeter in diameter, preferably about 3 millimeters. The coil should be placed close to the attachment point of the spring to the base plate. Now, it should be centered on a line passing through the midline of the tooth to be moved, and it should be lying perpendicular. The spring should be perpendicular to the direction of the deflection path. Okay, the arm should contact the tooth at right angles so that the desired direction of movement may be obtained. Now, sometimes to achieve this, we may have to crank the arm, meaning a bend slightly in the arm so that this portion will contact the teeth at the correct tangent. Now, also important, remember the coil must be placed on the side opposite to the direction of tooth movement. Now, what are self-supporting springs? Now, self-supporting spring can resist distortion forces on its own. Usually, they are made from stiff wires, usually zero point 0.7 or zero point 0.9 millimeter stainless wires. The stability ratio should be more or equal than 1. What is stability ratio? Stability ratio just simply means the stiffness in the direction of unwanted movement divided by the stiffness in the direction of the desired movement, and preferably should be more than or equal or more than 1. Now, examples of self-supporting springs are buccal canine retractor and a coffin spring. Okay, the non-self-supporting springs, they cannot resist distortion forces on their own, and they are usually made from very flexible zero point 0.5 millimeter hard stainless steel wires. Now, there's two ways of stabilizing such springs. One is to place a guard wire made from zero point 0.7 millimeter stainless steel wire, and this will lie above the active arm to prevent distortion from the base plate. Now, the next way of stabilizing the spring is to put the spring in a box. Okay, and this box is or boxing is made in the acrylic base plate. Thus, the spring will lie in a gap between the base plate and the mucosa. Uh, Examples of non-self-supporting springs are cantilever, various cantilever springs, and the T-spring. Finger spring. Now, the finger spring is also known as a palatal spring simply because it lies on the palatal side. It is used for mesiodistal movement along the line of the arch, for example, closure of diastema and the distal movement of canine. It is made from zero point 0.5 millimeter hard stainless steel wires. Now, it should be supported by boxing and guarding, and the activation of the spring is done by opening the helix maximum 3 millimeters for a zero point 0.5 millimeter wire. Now, is this spring design correct? What is wrong with it? Now, the next one, let's have a look, is the single cantilever spring. Now, this spring has a single helix with a single active arm. It is used for derotation of incisors and the labial movements of incisors. Made from zero point 0.5 millimeter hard stainless steel wire, should be boxed and guarded. Now, sometimes you have to crank the arm, as is shown here, to so that it keeps clear of other structures. The double cantilever spring is also known as a Z spring. It is used for both labial and lateral movements of incisors. It can also do minor derotations, and it can also do labial movement of more than one tooth. Made from zero point 0.5 millimeter hard stainless steel wire, and there are two coils in the clasp. Okay, now a few design pointers. The cantilever, the width of the cantilever spring, double cantilever spring must be within the mesiodistal width of the tooth. Okay, and the coils should all be in the same plane as the active arm. Now, cross cantilever spring, also known as pad cantilever springs or whip springs, they are used to move four incisors, upper incisors labially. Now, the T spring can be used for buccal movement of posterior teeth. Made from 0.5 millimeter hard stainless steel wire. It has T-shaped arm with loops. Now, there is also both vertical and horizontal components of force depending on the degree of slope of the tooth surface. And it is very easy to activate. We just need to pull the T-spring away from the base plate. Okay, again, the T-spring, as we can see, is width is confined within the mesio-distal width of the tooth. This is the wax up so that to do boxing for the T clasp. Now here, as you can see, the activation of the class is simply to use a Adams plier, grip the class and pull it away from the base plate. Okay, the next component is the canine retractors. Okay, canine retractors are springs that are used to move canines distally. Now, the usefulness of these retractors depends on the canine angulations. Now, for removable appliances, the canine must be mesially angulated. Now, fixed appliances are preferred if the canines are distally angulated or upright. As you can see in the diagram, a mesially angulated canine can be tipped back to a reasonably good alignment into the arch. Now, whereas a distally angulated canine, when tipped distally, it becomes more severely tipped um, distally. Now, the buccal canine retractor, it's used for buccally placed canine. It can move the tooth both distally and palatally. Made from 0.7 millimeter hard stainless steel wire. Thus, this retractor is a self-supporting retractor. Now, the coil is distal to the long axis of the canine. It must be placed as high as possible in the sulcus. And this spring is useful when the canine overlaps the lateral incisors, since in such a situation the palatal approach is not possible. What is a modified buccal canine retractor? The There are two modifications. One is the supported buccal canine retractor. It's called supported because it is similar to a standard buccal canine retractor, but it's made from only 0.5 millimeter stainless steel wire, which makes the spring very flexible. Therefore, the posterior part of the spring should be supported in a tubing or sleeve. This makes the clasp or retractor rigid in the vertical plane, but it's flexible mesiodistally. And this is important because the canine is going to be moved mesiodistally. Okay, the next modified buccal canine retractor is what is known as a stabilized buccal canine retractor. Again, it's similar to the standard buccal canine retractor made from 0.5 millimeter stainless steel wire, but here we have a stabilizer wire which is welded to the bridge of a clasp, example, a bridge of a Adams posteriorly, and it is also attached to the buccal canine retractor. Again, this makes the retractor rigid in the vertical direction but flexible mesiodistally. Now, reverse canine retractor. This is also known as the helical loop canine retractor. It's useful when the sulcus is shallow, example in the lower arch. Minimal retraction is needed, meaning the tooth is mild, and is made from 0.7 millimeter hard stainless steel wire. Now the U-loop canine retractor. Now for the U-loop canine retractor, only distal movement is possible, and the movement has to be minimal. It's made from a zero point 0.7 millimeter hard stainless steel wire. Coffin springs. Now, coffin springs are used for expansion of restricted maxillary arch, for correction of posterior crossbite, and also for differential expansion of the maxillary arch. It's made from a stiff wire, namely 1 to 1.25 millimeter hard stainless steel wire. It is cheap compared to screws. Now screws. Now screws are also a form of active component. They consist of a central screw thread, and they have right and left guide rods embedded in the base plate. That there's a nut in the center of the screw which can be turned for activation, and the base plate separates the moving teeth. Okay, so okay, now uh, have a look at these diagrams, and this is what I mean by the tooth movement will be based on how you split the base plate and also where the screw is located. If you compare these two diagrams here, the base plate split is nearly similar, except that the location of the screw is different. In the first diagram, the location of the screw will cause the the second premolar, first molar, and second molar to move buccally. Whereas in the second diagram, the location of the screw will cause the same teeth to be moved in a distal direction. Okay, the activation of the screws is done with a key which comes with the screw, and one turn of the screw, which is actually a quarter of a full turn, moves the moves the plate by 0.25 millimeters. The patient is expected to do 1 or 2 turns every 3 to 7 days according to requirement. Now, the amount of movement is a function of the thread height. Now, the amount of force exerted depends on the number of teeth moved similarly. Now, the advantages of using screws is it's easier to manage by the patient, especially for a patient who is less skillful. Okay, activation is done by patient at home, so meaning missed appointments does not disrupt the tooth movement. There is less tendency for the appliance to be dislodged, and forces generated can be controlled. Now, the disadvantages of screws are they are expensive. You will need a good technician to fabricate the screw appliance. This, the bulk of the screw makes the appliance bulky, and they can be difficult to repair in the event of breakages. Okay, let's have a look at the next component, which is the base plate. Now, what are the properties of ideal base plate? The base plate should be as thin as possible for patient comfort, but at the same time, it should be thick enough to be able to support the various retentive and active components. Use generally the thickness of the base plate will be the thickness of a single sheet of modeling wax. Now the plate should cover most of the hard palate, extending just distal to the first molars. Now it can also be done in a horseshoe shape, but the horseshoe shape coverage is less stable. The base plate must have a close fit around the cervical margins of teeth, but the acrylic should be trimmed clear of teeth that has to be moved. The base plate can be made either from a heat cured resin or from a self cured resin. Now, what are the functions of the base plate? There are three main functions. One, the base plate acts as a connector, whereby it supports all the active components and transmits and dissipates the forces from the active components. The second function is anchorage. Now, the base plate can prevents unwanted movements. The contact of the base plate with the palate and the cervical margin of all the teeth reinforces the anchorage. Now, the third function of the base plate is the base plate can become an active component by the incorporation either of a anterior bite plane. Now, let's have a look at the bite planes. First, we have a flat anterior bite plane. Now, this is obtained by extending the base plate behind the upper incisors from left to right canine. Now, this is used to correct a deep overbite. And how does it do this? Is it causes separation of the posterior teeth, and subsequently this posterior teeth will over erupt. Okay. Now, if we want to prevent the uh, upper anterior teeth from proclining, we can put incorporate a labial bow or do a incisor capping. Now, the flat anterior bite plane can also be used to correct TMJ problems. It can be used to correct bruxism. It can be used to correct occlusal prematurities, and it can be used as an periodontal splint. Now, the inclined anterior bite plane. Now, this bite plane inclines downwards and posteriorly at about 60 degrees. Now, it's used for the correction of a deep overbite. It also has a functional effect whereby it helps to promote the forward growth of the mandible. Thus, it's suitable for use with class 2 deep 2 incisors. Now, the suede bite plane. Now, this is basically a modification of the anterior inclined bite plane. So, this is the inclined anterior bite plane, and as you can see, the bite plane is extended over the incisal edge to produce the incisor capping. Now, the lower inclined anterior bite plane. Now, this is commonly known as the Catalan appliance. Catalan's appliance is used to correct the cross bite of a single anterior teeth. Now, posterior bite plane. The posterior bite planes are obtained by extending the base plate over the occlusal surfaces of posterior teeth. They provide occlusal correction for and correction of anterior cross bite. Now, the molar, it can also produce molar intrusion in growing patients for the purposes of correction of the anterior open bite. Now, let's have a look at some of the issues in fitting removable appliances. Now, before the patient arrives, when the appliance comes from the lab, the operator has to make sure there are no sharp projections on the appliance, and the appliance should fit correctly on the model, and ensure that the operator have to check that the active components and retentive components are correctly designed and positioned, and the active component should be free to move. Now, as much as possible, The delay between fabrication and fitting of the appliance should be kept as short as possible because a long time span will cause warpage of the appliance, the acrylic. Also, occlusal growth changes will make the appliance non-fitting. Okay, when the patient arrives in the clinic for the fitting appliance, the operator should check the fit in the mouth. He has to make adjust the base plate. For example, if the acrylic need to trimmed away from tooth that is to be moved, and he must adjust or activate the active components and measure the position of the teeth so that in future visits this can be compared to monitor progress. Now, what are the patient instructions that should be given once a removable appliance has been issued? The patient should be shown how to insert and remove the appliance correctly. And once the patient is shown, the patient must be asked to do it themselves. They should be advised on the duration of wear, which is usually full time wear. There may be they should be warned that initially there will be difficulties in speaking and there may be ulcerations. They should be advised on methods of cleaning the appliance and also storage of appliance when the appliance is not in the mouth. Now, at the follow-up visit, which is will be 6 weekly, ask the patient if the patient has experienced any difficulties in the use of the appliance and measure the teeth position to monitor the progress of teeth tooth movement. Now, the retentive component would have become slightly loose, so this should be adjusted and any active components should be reactivated. Okay, the references from for these lectures are found in these following textbooks. Uh, Thanks for listening to this lecture. Any questions, you can get me at this email address. Thank you.